COVID-19 keeps spreading across swaths of the United States, and national experts are telling Congress they're worried. They're also calling for more testing. Amna Nawaz will talk with a physician in a Texas city that's being hit hard. After this look at the day's events from congressional correspondent Lisa Desjardins.
It's a mixed bag, some good and some now we have a problem with.
From the nation's top infectious disease expert, Dr. Anthony Fauci, the latest assessment of where things stand more than 3 months into the pandemic. He and 3 other top national health officials testified at a congressional hearing. At the top of the agenda, rising numbers of cases across much of the Sun Belt.
The next couple of weeks are going to be critical in our ability to address those surgings that we're seeing in Florida, in Texas, in Arizona, and in other states. They're not the only ones that are having a difficulty.
In fact, a dozen states across the South and Southwest are hitting new infection records. New hotspots are emerging, even as some states move to reopen their economies. That includes places like Myrtle Beach, South Carolina, a popular vacation spot that's helped bump the state's new infection rate, when adjusted for population, to 4th place nationally. Still, Fauci said today he is optimistic that a vaccine to counter the spread could be ready by the end of this year or early next, and he vowed that officials will not cut corners to get there.
I would be very disappointed if we jumped to a conclusion before we knew that a vaccine was truly safe and truly effective, because I wouldn't want the perpetual ambiguity of not knowing whether or not it is truly safe and truly effective.
Also testifying today, Admiral Brett Giroir, Assistant Secretary of Health at the Department of Health and Human Services. He focused on testing.
The only way that we will be able to understand who has the disease, who is infected and can pass it, and to do appropriate contact tracing is to test appropriately, smartly, in as many people as we can.
That's become a contentious point within the administration after President Trump said he called for scaling back tests. Mr. Trump said bluntly because testing was driving up case numbers. Aides said he was kidding, but today came this.
I don't kid. Let me just tell you, let me make it clear.
Leaving the White House for Arizona this morning, Mr. Trump doubled down on the idea.
Testing is a double-edged sword. In one way, it tells you you have cases. In another way, you find out where the cases are, and you do a good job.
Do you agree with
Back
that?
at the House committee hearing, Fauci said that, in fact, the president has never asked them to cut back on testing.
But to my knowledge, none of us have ever been told to slow down on testing. That just is a fact. In fact, we will be doing more testing.
All of this as the virus continues to pass new milestones around the world. Cases in South Africa topped 100,000 today, totaling nearly a third of all infections across the African continent. The spread is also accelerating in India, where 15,000 new cases were recorded in the past day. The picture is starkly different elsewhere.
Today, we can say that our long national hibernation is beginning to come to an end, and life is returning to our streets and to our shops.
British Prime Minister Boris Johnson said the country will begin to ease social distancing restrictions, including at pubs and restaurants, by early July. For the PBS NewsHour, I'm Lisa Desjardins.